Hello there, you're watching Proactive London. So Sensyne Health has a newly appointed Chief Operating Officer, Michael Macdonnell. He is from Google Health as well, and I'm delighted to be joined with Michael today. Hello to you. Congratulations on the new role, Michael.
Thank you very much. I haven't started yet, but I'm looking forward to getting stuck in.
Oh, brilliant. I bet you are. So first of all, before we begin by talking about how you're going to get stuck in and what you're going to bring to the company, should we begin with a quick introduction of the business for us?
Yeah. So Sensyne is a healthcare AI company that on the one hand builds software applications for remote monitoring in healthcare for digital therapeutics, and on the other hand also provides R&D services to the pharma industry. So what does that actually mean? Well, it means, for instance, more recently, they've developed a COVID application that helps doctors in hospital make better decisions about what choices to make for the care of a patient, so whether they should be put on ventilation or not, using data to underpin those choices. And in the pharma industry, as you'll know, we know that all too often, actually, specific drugs don't work with specific people. So in order to accelerate that, we provide services to help analyze patient populations using anonymized data drawn from the NHS and our NHS partners that accelerates that drug development portfolio.
And what attracted you, Michael, to the company, Sensyne?
Well, I think first off, the thing I'd say is the immense potential, which I think we're seeing in the pandemic times, for how data can be part of improving healthcare. And I've been working in this field now for several years, but it's really quite unrealized potential still. We still find hospitals that are using paper and so forth. There's just a huge amount of potential to improve care for patients, for the NHS, for health systems more widely. So that's the first thing. Mm-hmm. The second thing is Sensyne's unique business model. It's combines social impact. So very important to me is that we try to do something good with our lives as well as something that creates value, along with these analytical capabilities, and importantly, gives value back to the NHS and to its healthcare partners as part of that business model. Mm-hmm. And then the last thing I'd say is, look, from those I met, an absolutely unbelievable team with great capabilities who I can't wait to work with. And I just think that it's got such potential as a growing business. So that's why I've joined.
Excellent. You mentioned the NHS there. We know you've got a vast experience and knowledge with the NHS, with tech as well. What do you think you personally can bring to the company?
Well, I think that I would start with that. I've worked in and around healthcare. It's a specific, all industries claim to be unique, but healthcare really does feel like a unique one. It's changing all the time. It's got specific risks and dynamics to it. And I've worked both in the UK and the US and other contexts. So I think the first thing is really understanding the health environments and the dynamics and strategic kind of trends that drive it. The second thing is more recently, I've been, in Google and elsewhere, learning a lot about how to apply artificial intelligence and machine learning to the healthcare context. And this is still a new, burgeoning, developing area. But, that's something that I can bring, and I understand what it takes to go from theory and research to deployable products.
And we're very much in uncharted territory right now in healthcare. We've never known such a scenario in our lifetimes. How do you think it's kind of changed the face of healthcare, and how do you plan to sort of deal with that?
Yeah, I mean, it's one of these things where it's a bit, there's a lot of future tellers out there, and I'm hesitant to join them, but I do think we have seen a massive uptick in virtual care and other online services in healthcare in a way that just months ago wasn't happening. So I expect that the ability to, through digital means, access healthcare to only grow. The second thing I think I'd say is the power of data has really been illustrated, where before the arguments were all around privacy and so forth, which are very important arguments to have. That has been slightly rebalanced towards the need to share data carefully, safely, regulated way in order to save lives, in order to improve care. And we've seen that live. I've worked with many doctors over the COVID period, watching them learn in real time about how to manage this new disease. And they've done that by sharing data and understanding how each other have had successes. So I think we will that will only be a greater aspect of healthcare in the future.
Absolutely. And specifically, what will be your responsibilities?
Well, I think number one, to make sure the business is on a sound footing and does grow, and that we build out a great team. But I'll also be looking after both sides of our business. On the one hand, the software development side or division, and the discovery sciences side, the pharma side as well. So those are my kind of core responsibilities. The last thing I'd say is we really want to encourage many more NHS partners to join us. We've already got several and many more at the door. So part of my role, given my background, will be to entice some others to come on this fantastic journey.
It looks like you're all set to get stuck in, as you say, Michael. Thank you very much indeed. Lovely to meet you. That's Michael Macdonnell there talking to us today here on Proactive London from Sensyne Health.
Thanks.